So now we go for the next presentation. I'm going to introduce our next speaker, who is Carlos, our project coordinator in ClimAir. So Carlos develops his research activity on IDENER, which is a research organization in Spain. He has a background in chemical engineering, and he applies his expertise in advanced research and strategic coordination of complex projects. Respect ClimAir, he leads the ClimAir project, which uses environmental data and advanced data analysis to understand and predict the impact of air pollution and climate change on public health. I have to say that the consortium is composed by 18 partners from the following countries: Spain, Romania, Luxembourg, Ukraine, Italy, Ireland, Turkey, Poland, Finland, Greece, Germany, France, Belgium, Austria, and Switzerland. I love this.
Thank you. About ClimAir, ClimAir is a project that the main focus or the main work is to identify the correlations between the climate change, air contamination, and health outcomes in non-communicable disease, specifically asthma and allergic rhinitis. Can I get to change the slide? Don't worry, it's okay. Where is the? No. Okay. A little bit of context. Well, you know what is the pressing challenge here with air pollution, but like the big numbers, there is estimation that air pollution contributes to 7 million deaths annually from non-communicable disease. Primarily, specifically for asthma, it is estimated to affect around 260 million people during 2019 and causing almost 500,000 deaths. Regarding allergic rhinitis, it affects estimated to be to affect more than 400 million people, with the prevalence being 10%, between 10% and 30% in adults and over 40% among children. Also, it's important to highlight the climate change effect because climate change, apart from the obvious effects that it has, it's also have an important modulation of the air pollution values, as it makes let's say the contaminants more difficult to be dispersed due to the temperature increase, for example. Also, it elongates the allergy seasons, even increase the pollen allergenicity, modify weather patterns, and also increase the frequency of extreme weather events. So that's why we are. The main focus is to find these links between these three aspects and the combined effect, basically, of the climate change and air pollution in these non-communicable diseases. For the scientific challenge and context, where we consider that are the major advancement that ClimAir brings to the table is the mechanistic study to comprehend the biological mechanisms underlying these integrated links and correlations. Also, the multipollutant assessment to investigate how not only the traditional traffic-related air pollutants, but also emerging pollutants interact with climate change and also have an effect on non-communicable diseases. The combined application of modeling approaches like land use regression, chemical dispersions, and AI models to identify these links between exposures and diseases. The offering of the creation of intelligent decision support systems to assist the authorities to effectively mitigate and take action to diminish the health impacts associated. and to design, implement, and also monitoring tailored interventions in our pilots to provide key insight to develop further strategies. The scientific approach of ClimAir could be summarized in four different blocks. The first block would be the clinical study part. The clinical study in ClimAir is actually an observational study. We have 9 medical centers around Europe, which are performing an ambidextrous clinical study, which around 200 patients been evaluated, been followed. Also, then for the next block will be the technical development and implementation. Regarding the air pollution and climate modeling, we are using large eddy simulation coupling with SILAM simulations using 3D city detail models for the target cities of the project, and evaluating various air pollutants like NO2, O3, particulate matter, SO2, pollen, and different organic compounds. The next step would be the federated learning and AI health impact projection development. For that, for the ones that maybe don't know what federated learning is, it is an approach, a patient privacy preserving approach to machine learning, which basically allows you to build an AI model from individual models built in the clinical centers in a way that the local models, the data that they use never leaves the server of the medical center, but instead these local models share with a global model hyperparameters and internal parameters of the model and not the data. So that's why it's a patient privacy preserving approach. Then would be the ClimAir tool development, which is a tool that gathers all the technical developments through the ClimAir project in one user-friendly tool that will help, offer scenario simulations, metrics, and intervention assessment. And then we'll have the block of design, implementation of solutions to provide evidence-based guidelines for mitigation of the health impacts. And finally, the dissemination strategy block, which includes professional training programs and also engagement and wide exploitation in the wide sense of the word. For the key expected results, ClimAir focus, the key expected results, the most important results would be the novel scientific evidence, basically the quantification, the correlation of the exposure to climate change and air pollution and development of asthma and allergic rhinitis, that will establish a new scientific foundation to understanding the root of this health of this relation. Also, the harmonized environmental datasets that we are going to produce. We are going to produce high-resolution datasets and environmental information for our target cities, which are Berlin, Malaga, Milan, Thessaloniki, Brasov, Lodz, Chernisty, Toulouse, and the city of Luxembourg. That can serve as a resource for future research in those places. Also, as I said, the ClimAir tool would be a user-friendly that is aimed to allow the stakeholders to forecast, we offer forecasts in air pollution levels and health impacts, also to predict incidence of respiratory diseases in specific areas, simulate the impact of hypothetical interventions, such as new regulations or inclusion of green spaces, to say some, provide individual level recommendations, and also give access to training courses and best practices guidelines. And then we also have evidence-based guidelines that will be developed with the recommendations for policymakers, healthcare professionals, urban planners on how to apply all the knowledge that we gather through the project into the real world. Saying that, for the expected political and societal impact, we expect to have influence in the real world decisions at some point. For example, for policymakers, the ClimAir tool will, for example, allow for simulation of policy effects before implementation. For healthcare workers, it will provide new insight and predictive tool for the medical staff to understand better the environmental factor, how they affect their patients, which will can lead to more targeted intervention and more efficient treatment strategies for asthma and allergy rhinitis specifically. And for urban planners, also the ClimAir tool will enable to design healthier or better strategies that can address this issue. And then for the other expected big contribution expected is fostering the public awareness and resilience on this matter. And that's why we are going to create the Learning Factory. And also the Learning Factory basically is a central hub for our training courses. And a communication strategy to translate the complex scientific outputs of the project into accessible training courses and materials for all kinds of stakeholders, leading, fortunately, to pollution mitigation strategies, lowering air pollution levels, and related illnesses. And also we expect to have an increase in health knowledge related to the air pollution and also a public engagement in the pollution mitigation efforts. I think that's all from my side. Thank you very much.